In this section, we will look at the framework, goals, and phases of strategic family therapy. We will continue our focus on the three models that we have been looking at, which is the MRI, the strategic work of Haley, which was furthered by Mundanes, as well as the Milan systemic approach. If we consider the general framework for therapy, there are quite a few similarities across all three approaches. Firstly, they all engage the clients, they place focus on the system, and they define the problem clearly. And in defining the problem clearly, they also set a clear goal for therapy. Furthermore, all seek to actively involve each member of the family in therapy, or also accept the family where it is at, as well as focusing on the definition of the problem, or seek to understand the family as it understands itself rather than challenging or confronting. It's also good to note here the strategic therapists offer no explanations. Instead, all give assignments for tasks to be completed outside of the therapy session. Some of these directives may include conscious attempts to change. However, most assignments are likely to be paradoxical. But different therapists devise different models for implementing their theoretical framework, and this is what we will consider later on in this section. If we consider the goals of strategic family therapy from the three different approaches that we have been focusing on, the MRI approach, in terms of goal setting, is proudly minimalistic. Therapists using this viewpoint see that as soon as the presenting problem is resolved, the therapy can be concluded, even when other problems are still apparent. If the family doesn't ask for help with these apparent problems, they aren't focused on at all. This is because the MRI viewpoint see people who have problems as stuck rather than sick. They see their main role as simply to help people to get moving again. MRI therapists help families clearly define clear and reachable goals so that everybody knows when treatment has been successful. They often find that much therapy takes place simply in the process of pushing clients to set concrete goals, because in doing so, clients are forced to clarify vague distractions. Also, in getting clients to define achievable goals, MRI therapists help people let go of utopian aspirations which are likely to lead to disappointment. In trying to achieve problem resolution, the immediate aim is to change the behavioral responses of people to their problems. If we consider the goals of Haley's approach was even more behavioral than the MRI group. Haley downplayed the importance of insights, and he was very scornful of therapists who help clients understand why they did things but failed to get them to do something different. Haley's goal was often a structural reorganization of the family, and he particularly focused on hierarchy and generational boundaries. Unlike in structural family therapy, his structural goals were always directly related to the presenting problem. The MRI and Haley models heavily influenced the beginning work of the Milan group. The Milan associates, at the early stages of their work, expanded the network of people involved in maintaining the problem, but were still primarily interested in interrupting destructive family games. The techniques they developed differed from other strategic schools, however, in that they were less behavioral focused and were rather designed to expose covert collusions and reframe motives for strange behavior. Even though their focus was less problem focused and more interested in changing families' beliefs than other strategic therapists, the original Milan approach was no less manipulative. This can be seen that in the responsibility for change rested on the therapist, whose job was to outwit resistance. In the 1980s, however, the Milan associates split into two groups. And here, if we look at Palazzoli, she subsequently formed groups which focused on insight for the individual patient. And then if we look at the Boscolo and Schergen, they moved away from strategically manipulating families, and they moved towards collaborating with them to form systemic hypothesis around their problem. From this viewpoint, therapy became more of a research expedition that the therapist entered without specific goals or strategies, trusting that the process of self-examination would allow families to choose to change their unproductive patterns. The therapist hence was released from the responsibility for any certain outcome and adopted an attitude of curiosity towards families rather than the interventive attitude of strategic therapists. By moving in this direction, Boscola and Schergen took a position opposite to that of the strategic predecessors. And this collaborative philosophy became the bridge for many strategic therapists to the narrative approaches of the 1990s. And we will consider the narrative approaches later on in our module outline. If we consider the assessment stage of therapy from all three approaches, the MRI group would look at carefully defining the presenting problem and figuring out why it continued. It would, and this means, be non-historic and symptom-focused. Haley and Mandanes, in the therapy assessment stage, would look at examining behavioral sequences around the problem, as well as examining structural anomalies, which would be things such as weak parental hierarchies and cross-generational coalitions. The Milan group, if you had to do therapeutic assessment from their approach, you would do a preliminary hypothesis, which you would then test using circular questioning, and this would account for systemic explanations. We will now turn our attention to briefly looking at the therapeutic techniques that are used from the MRI point of view, the strategic Haley-Mandane's point of view, and the Milan systemic point of view. As I said, will just be a brief overview, but you can further explore the different techniques by firstly reading your assigned chapters in your BECFAR 2014, as well as Nichols' readings that are on Funda. I've also placed 2 journal articles in the resources section that you can also read that look at the MRI approach as well as the Milan approach, and you can also watch the video link that follows this section that further outlines the work of Haley. If we consider firstly the MRI Brief Therapy Center, they would look at therapy by finding the most motivated person in the system. They would gain a clear understanding of the problem. They would look at what will be the first signs that things are getting better. They would inquire about attempted solutions. They would observe and interrupt problem maintaining sequences, and they also made use of the therapeutic paradox. For example, here the family encourages the depressed member to be sad so that he feels less guilt for not being happy. If we consider the works of Haley and Mandanes, here they saw that for therapy to end well, it must begin properly. In terms of techniques, Haley joined and interviewed the entire family, and the interview session went through various stages. The social stage, the problem stage, interaction stage, goal-setting stage, and task-orientated stage. And Haley very much made use of the use of directives, and as I said, this is unpacked within the video that follows. Lastly, the Milan systemic approach, in terms of therapy, they would go through a number of different stages: the pre-session, session, intersession, intervention, post-session, and discussion. And this model used a number of techniques such as positive connotation, which is reframing without blaming, rituals, which is looked at the exaggerated family rules and myths, circular questioning, They would also use the techniques of team approach and neutrality. And as I mentioned before, these you can unpack further through the readings and the videos.